Cracking the code. Why weight loss stalls post-bariatric surgery. Welcome to Bariatric Success Beyond Diets channel. In this video, I will talk to you about why your weight might stall post-bariatric surgery, even if you just had it a few weeks ago. Has that ever happened to you? Well, keep on watching. I will be talking about the reasons why it happens and what to do about it. My name is Marina James. I had my surgery 9 years ago, and in the first year post-surgery, I lost 100% of my excess body weight. Literally half of me was gone. In addition to being a patient, I am also a bariatric certified counselor, therapist, and a life coach. And I am here to share with you my life experience as well as what I have learned on my journey post-bariatric through education. But first, a disclaimer. This video is for informational purposes only. If you need to talk about your personal details, what you're experiencing, you need to reach out to a medical professional. Okay, so is it normal for your weight to stall even just a few weeks post-bariatric surgery? Yes, it is. Why does it happen? There are several reasons. Let's go through them one by one, and after that I will give you ideas of what to do about it. It could be your hydration level. Now, if you lost a lot of weight right before the surgery to shrink your fatty liver, that special diet you were on, you also might have lost a lot of water weight. If you've lost a lot of water weight, your body is trying to recalibrate. It will go to a stall while it's increasing the amount of fluid in your body until it recalibrates. So if you lost a lot of weight prior to surgery or right after surgery, it is very possible your hydration level and your body is recalibrating. It doesn't mean it's not doing anything. It's doing exactly what it's supposed to do. It's balancing itself out. If you do not see the weight lost on the scale, you could be seeing it in your inches, or you can simply be feeling better overall. So if you recently lost a lot of weight, do not just look at the scale, look at your inches and just see how your body feels. The next reason it could be a lack of sleep. If you're not getting enough sleep, your body needs energy. And your body does not want to give up the energy that it has stored in your fat cells, which means your weight is not dropping. The next one is take a look at your diet. If you recently had your surgery, you probably are still on a liquid diet. If you're on a liquid diet, make sure that you are consuming proper liquids. We'll discuss it in the second part of the video. The next reason, it could be your exercise, your movement. Are you exercising enough? Are you moving at all? And if so, then how much? You could be going through hormonal fluctuations. Post-bariatric surgery, your hormones will be changing. And those hormonal changes can impact your metabolism and your appetite. Let's take a look at psychological factors. Stress and anxiety could cause you to go towards food, which is something that you have always done when you were stressed and anxious. You need to reduce your stress and anxiety level, or your body will keep wanting to go towards the food and you could be cheating on your diet. Additionally, stress and anxiety can release hormones like cortisol, which slows down the weight loss. So get your stress and anxiety under control, and again, we will talk about that a little bit later in this video. Please keep in mind that when you had your bariatric surgery, you started at a point that is not necessarily the same as other people. If you had higher BMI, you will lose more weight and have less stalls. If you had lower BMI prior to surgery, you will have more stalls. If you are at a younger age, you will lose weight faster simply because your metabolism is faster than the people with older age. If you take medications, certain medications could cause stalls. Please do not discontinue your medication. Talk to your doctor, lower your medication with the approval of your doctor and not by itself just because you could be at a stall. Now, here's an interesting one. Most people don't even consider it when they look at their weight and the stall that they might be experiencing. in the winter, and right now we're in winter months, it is cold outside and I am wearing sweaters even inside. When it is cold outside, your body does not want to release its padding. And I am telling you, when you lose all that weight, you will be cold all the time because everything that you've been piling on over the years has kept you warm. Fat cells keeps you warm. Your body doesn't want to release the warm, it's protected itself. It is subconscious. It does not want to release the fat. Therefore, it puts you at a stall. Again, it doesn't mean it's not doing anything. If you're eating properly, you're doing what doctor tells you. Come spring and it gets warmer outside, just watch the weight drop. So what do you do if you get at a stall? Consult your doctor. Make sure it's nothing else but simple stall, especially if you have been at a stall for more than a week or two. Several days to a few weeks is very normal. Past a few weeks, talk to your medical team where you had your surgery to see where you could change what. Take a look at your diet. Take a look at what you're eating. You have to make sure you consume as much protein as you're supposed to. For women, it is 90 grams or more. For men, it is 120 or more. Now, if you just had your surgery, you might not even be able to get to the 90 through 120 grams. Therefore, make sure that you consume as much as you can and then fill in the rest with fruits, vegetables, and nothing else yet. If you're later post-surgery, take a look to see how much carbs you're consuming. Take a look at what you're drinking. You're supposed to be drinking clear liquids. Then you're supposed to be drinking liquids that are not necessarily clear, but still just liquids. Make sure that it's not juices, which might have sugar, and do not consume artificial sweeteners. They could also cause a stall simply because your body could be tricked into thinking it's getting something and it's not getting it. It only gets a sweet flavor and it is very confused. When your body is confused, it doesn't want to shed weight either. So be very clear with your body. Make sure you give it what it needs. Prioritize your sleep. Make sure you get enough rest. I cannot say it enough. Rest is even more important than your diet and your exercise. You don't get enough rest, you're not functional. It's almost like trying to use your phone. If you do not charge it, it is on 3%. It doesn't want to work and it just wants to shut down. Okay? Don't keep your body at 3%. Keep it at 100 or close to. Get your rest. Increase your physical activity. I know it's hard. It's cold outside. You can work out inside. Honestly, you don't even have to work out. Go up and down the stairs. Go back and forth in a hallway. Go down the block and back. Do some cleaning. Do some playing with your kids. Do some playing with your dog. Whatever it is around you that have you do some sort of movement. Dance in the kitchen while you're cooking, or just dance in the kitchen. All of that is movement. All of that is good to start and increase it 10%. Add another few things to it. Add another few minutes to it. Just increase it slightly at a time to get through the stall, and of course keep moving because that will get you to a healthy lifestyle. Manage your stress. You will have triggers just like you've had before your surgery. You will be triggered by certain words, certain feelings, certain thoughts. Before you dealt with it by possibly going to eat. It could be binge eating, it could be just snacking and grazing. Grazing is when you eat throughout the whole day. That could also put you at a stall, just consuming more calories and you don't even realize you're consuming when you're not hungry. So pay attention to why you're eating. If you're stressed and it is a trigger that's causing you to eat, you need to work through those triggers. That means maybe you need to work with a therapist like me, which, by the way, I'm available to work with. You can find me on the links below. Work through your triggers. You can use practices like mindfulness, meditation, yoga, breathing, doing something fun. Anytime you do activity that is fun for you, your stress will go down, your anxiety will go down. It could be anything. It could be going for a walk, watching a movie, taking a bubble bath, reading a book. Just take some time for yourself and do something that you love. It doesn't have to be food. And if it is food, it doesn't have to be a lot. If getting on a scale stresses you out, don't get on the scale. You can measure inches. You can also see how your clothes fits. You don't even have to measure anything, honestly. I know that some people recover from eating disorders, and getting on a scale is extremely stressful and is not advised. So please, don't do that then. Do something that is not stressful. Measure yourself and check your clothes and see how you feel. Your body will tell you a lot if you listen. And of course, seek professional support. People out there who offer services, whether it is medical advice, dietary advice, whether it is physical exercise advice, or a therapist like me. Now, I also want to share with you a couple of interesting things that I have discovered in my journey of knowledge seeking. It is to help you kind of guide yourself through different milestones. 1, if you lost a lot of weight or losing a lot of weight in the first months or 2, I would say 30 pounds, 20 pounds per month, it is not necessarily what you do, it is your genetics. So if you're the opposite person, the one who did not lose that weight, and you might be doing absolutely everything the person who lost weight, that might be your genetics too. So those who lost a lot of weight, just be grateful and know that it is going well. Those who are not losing weight, understand that it might be not something you're doing, but it is simply genetics. You have different genetics than those who lose weight. Do not blame yourself. You might be losing a little bit less, but it's not the end of the world. If you work hard at it, you will get to the end goal that you have. Number 2, when you reach about 4 months mark, take a look at how much weight you have lost. Multiply it by 2, and that should be an approximate amount you should expect to lose for you personally. Now, it might not be 100% of excess body weight. Not everyone loses 100%. As a matter of fact, that's rarity. You are to expect, if you had a sleeve, to lose somewhere between 40-50% of excess body weight, and 60 or so you had bypass. To get to 100% weight loss of excess body weight, you have to really be on point and do a lot. It is not just the surgery. Surgery does not just has you drop the weight. If you don't work on the rest of you, the weight will come back, but that's for another video. We're talking here about stalls. So when you get to about 4 months, take a look at what it is that you have lost already, multiplied by 2, and you will have an idea of what it is you're to expect to lose total weight. Keep in mind that if you had a sleeve, 7 to 9 months is a mark when your body starts returning to somewhat normal understanding of what it's doing pre-surgery. Your weight will slow down by a lot. So your first 7 to 9 months are crucial to do everything you can in your power. It's almost like if you're on an airplane and you get to a jet stream. Right now you're on a jet stream. You have 9 months tops to get on it. After that, it might start getting rocky and more difficult to get to your destination. In total, most people lose all of their excess weight that they're losing because of the surgery 12 to 18 months post-surgery. After that, it's not the surgery that's doing it, it will be you. So keep in mind, that is the timeline you have. So if you have not had your surgery yet and you're looking into having one, or you're just starting your journey, do everything in your power to get to your weight goal, including hiring a team, other people, their advice, their support to get to your destination. After 12 to 18 months, what will get you going and will keep you at a healthy lifestyle would be your new relationship with food, your new mindset, and your new outlook on life. If you have any questions, please DM me, write me a personal message. If you would like to see different videos on different topics, please let me know and I will make them for you. And that is it for this video. If you like this video, give it a thumbs up. If you know of someone who could use it, share it, and subscribe to get more notifications from videos from me. Thank you. Good luck on your journey. Love you all.